Chapter 14 is going to review special populations. Adults and children alike should participate in wellness, exercise, and fitness programs to promote and maintain a good quality, long life. Many of these individuals are among the specific populations afflicted with different diseases. These can be cardiovascular, immunological, metabolic, neuromuscular, orthopedic, respiratory, and other conditions. These conditions affect the body in various ways and can influence how the individual performs during physical activity and exercise. In some manner, the condition places limitations on participation in physical activity and exercise. These individuals are not able to participate in activity as individuals unaffected by these conditions would. Exercise program modifications, therefore, are necessary so the individual can participate in an effective, safe manner. The first part to Chapter 14 we'll look at is age. We'll look at youth athletes and then older adult athletes. An athlete who is in the prepubescent through adolescent age group is considered a youth athlete. Masters athletes are over the age of 40 or 50, and older adult athletes are age 65 years or older. Each of these groups have very special considerations. Due to the ages, young masters and older adult athletes have specific needs that differ from those of average athletes. Let's first look at youth athletes. Youth athletes are growing physically and emotionally. Their bodies are constantly changing. The epiphyseal plates or growth plates at the ends of long bones are delicate during the youth years. Therefore, these areas are susceptible to fractures. A youth's muscles do not grow as quickly or in the same proportion as the bones do. When young athletes create joint movement, the bone pulls the muscles, which can cause microtears, or the tendon can pull off its attachment, causing apophysitis, such as Osgood-Schlatter disease, which we looked at before. Likewise, youth muscles are not as flexible as compared to adult muscles, which predispose them to muscle strains. A youth can be injured while participating in activities including sports and conditioning exercise due to a number of factors. Youth athletes do not tolerate the heat as well as average-age adult athletes. They tend to take in more heat from the environment and sweat less. These athletes should acclimatize for a period of 10 to 14 days, so this does not affect them. Many youth athletes today are obese and sedentary, with no previous physical activity, which makes them at risk for injury. Unfortunately, many inexperienced coaches fail to teach youth athletes proper skills as well as proper conditioning. Youth athletes often do not condition their bodies at all or may condition too much. Lastly, youth athletes must be properly fitted with helmets and other equipment appropriate for the sport. If they do wear poorly fitted equipment, they could be predisposed to a severe injury. Conditioning and strength training youth athletes was considered harmful in the past, but now research has shown that when properly executed with appropriate progression and intensity, conditioning and strength training exercises can be beneficial for youth athletes. The American Academy of Pediatrics suggests that powerful Olympic-type lifts must not be performed until after skeletal maturity has been reached. However, young athletes can perform weight training successfully with supervision, using low weights and more repetitions while avoiding high weight, explosive repetitions. Aerobic capacity in youth athletes is lower than in adults. Also, youth athletes are not as capable of determining proper exercise intensity or calculating heart rate properly, especially those under 8 years of age. Overall, we have to take into consideration these recommendations by the American Academy of Pediatrics. First, activity preparation should not occur more than 5 days a week and in one sport per season. We should vary training exercises so that undue stress is not placed on the same body area. And lastly, we need to be mindful of the ambient temperature, humidity, and environment in general in which the youth athlete participates. Let's move on to masters and older adult athletes. We need to take into consideration many areas regarding exercise for masters and older adult athletes. As with athletes of all ages, masters and older adult athletes should have a thorough pre-participation exam along with a stress test to be certain they are able to handle the physical activity and exercise demands. Aerobic exercise for sedentary masters and older adults should start gradually and at a very low intensity. Progression of activities can be as tolerated. These individuals are not as able to handle the hot humid environments as they were when they were young adults. They may take prescription medication, have chronic diseases, and have less muscle mass. These factors affect their body's ability to tolerate environmental heat and dissipate body heat through sweat. Masters and older adult athletes have also more barriers to exercise that can hinder exercise programming compared to other adult athletes. Some of these barriers include balance difficulties, cognitive decline, musculoskeletal discomfort, a negative attitude toward exercise, fear of injury, lack of self-confidence in completing activities, and daily habits and routines that they are uncomfortable changing. We need to assist these athletes by thoroughly discussing their goals and the setting of their goals. We can discuss with the athlete how to best fit exercise into their daily routine, learn the intricacies of their personality, and determine their motivation toward exercise. Because muscle mass decreases with age, masters and older adult athletes do not require the same amount of total calories per day as young athletes. However, with age, masters and older adult athletes must increase vitamin D, calcium, and magnesium intake to maintain optimal nutrition. In addition, iron requirements decrease in women as women become postmenopausal and become equal to men's requirements. To obtain optimal results, we need to consider these nutritional needs when we develop a master's or older adult's physical activity or exercise program. Next, we will be looking at specific cardiovascular conditions. Adults who have cardiovascular conditions can significantly benefit from physical activity and exercise. Exercise benefits include increases in heart and lung efficiency and maximal oxygen consumption, along with decreases in body weight, fat stores, low-density lipoproteins, or LDLs, cholesterol, and triglycerides, heart rate, blood pressure, and symptoms of angina. We need to consider the specific cardiovascular conditions that we'll be talking about when developing a safe exercise program. All adults with these cardiovascular conditions must be under the supervision of a physician. We need to first obtain the athlete's consent to communicate with his or her physician, and we need to work closely with the physician when developing an exercise program. All adults with cardiovascular conditions need to be stress tested prior to engaging in an exercise program. The first cardiovascular condition we'll look at is angina. Angina is chest pain created due to lack of oxygenated blood flow to the heart. Often this lack of blood flow is due to plaque buildup within the coronary arteries due to high LDL cholesterol and triglyceride levels. Stable angina is diagnosed when a pain occurs in a predictable manner during physical activity and exercise. The pain can also spread to the neck, shoulders, and arms. Exercise can help decrease coronary artery plaque. Exercise can also help with increasing oxygenated blood supply. Adults with angina must follow a warm-up and cool-down protocol as with other conditioning principles. Overall, aerobic physical activity should be performed, which may include walking and household activities such as cleaning and gardening. Adults with angina can perform resistance training 2 days a week for 15-minute sessions. The strength training should focus on circuit training with light resistance. Flexibility exercises are beneficial for the athlete's upper and lower body as well. Stretching muscles 2 to 3 days a week can help decrease the risk of musculoskeletal injury. During this time, we need to orient the athlete to their program. This includes educating him or her on the importance of communication. He or she must inform the healthcare provider immediately when they are experiencing symptoms of angina during exercise. We also need to be aware of medication that the athlete takes for angina. Also, in the program, we need to evaluate and record the athlete's heart rate and blood pressure before and after an exercise session. During strength training activities, athletes must avoid performing the Valsalva maneuver. The Valsalva maneuver is when an athlete holds his or her breath and attempts to forcefully expire through his or her closed mouth or nose. This maneuver needs to be avoided so that blood pressure, blood volume, and heart rate are not detrimentally altered during exercise. If at any time the athlete's angina symptoms change or increase during or due to physical activity and exercise sessions, they must be referred to the physician and informed. Our next condition is hypertension. Hypertension is high blood pressure. When all athletes exercise, their systolic blood pressure rises. Exercising athletes who have high blood pressure see more dramatic increases of systolic blood pressure than do athletes without high blood pressure. A primary goal for these individuals should be for the individual to lose weight and eat nutritious foods. Adults with high blood pressure should also make lifestyle changes to assist in decreasing blood pressure. In regards to exercise, adults with high blood pressure must progress to a goal of completing 30 minutes of aerobic physical activity or exercise for as many days per week as possible. Within this exercise, low-intensity exercise is effective in decreasing blood pressure. When we look at this low-intensity exercise, the hypertensive athlete should work up to 40 to 60% of their maximum heart rate. Circuit training has been shown to be more purposeful than strength training in decreasing blood pressure for an athlete with high blood pressure. Overall, athletes with high blood pressure should attempt to expend at least 300 kilocalories per week at first and then increase the intensity, duration, and frequency of exercise. Keep in mind, we need to monitor individuals that have hypertension blood pressure before and after exercise. An individual who has a systolic pressure greater than 200 millimeters of mercury or a diastolic pressure greater than 115 millimeters of mercury should not exercise until the blood pressure is controlled with medication. Our last condition we'll look at is cardiovascular disease and heart attack. Cardiovascular disease, also referred to as heart disease, is a broad term utilized to describe ill conditions of the heart. This disease includes heart rhythm and congenital abnormalities, infections, and coronary artery insufficiencies. These conditions are typically treated with medication and lifestyle changes. Cardiovascular disease can cause significant damage to the heart and result in a heart attack. A heart attack, also called a myocardial infarction, occurs when one of the coronary arteries is blocked due to plaque. As a result, not enough oxygenated blood is delivered to a portion of the heart, and as a result, that portion dies. Individuals who sustained a heart attack complete 4 phases of cardiac rehab. In phase 1, exercise includes simple exercises such as moving from a standing to a sitting position and back again. Phases 2 through 4 involve aerobic exercise using both upper and lower body movements. Mild circuit training, resistance exercises performed 2 to 3 days a week can be introduced during phases 2 through 4 for athletes who are stable enough to their symptoms. Flexibility exercises are performed frequently to help decrease the risk of injury. As with individuals suffering from angina, we need to make sure that they avoid performing the Valsalva maneuver during exercise. Athletes with any cardiovascular condition or who have suffered a heart attack should not participate in physical activity in extreme environments, both hot and cold, due to circulatory changes that could detrimentally affect their condition. Lastly, we need to make sure we're aware of medication that the athlete is on. Medication for the central nervous system may cause the athlete to become faint or dizzy during exercise. Each of these factors we have discussed must be seriously considered when the individual is commencing a physical activity and exercise program.